Hello everyone. Today let's learn about Myasthenia gravis. Myasthenia means muscle weakness and gravis means grave. It's a grave muscle weakness. What happens is it primarily affects the skeletal muscles. The people with Myasthenia gravis they look fine when they wake up, but as the day progresses, they feel weaker, and they get even more weaker by doing repetitive movements like chopping vegetables. Myasthenia gravis is an autoimmune condition. It is very rare. It affects 15 people in 300,000 members. So, Myasthenia gravis can affect the ocular muscles, extraocular muscles, that is the muscles which are responsible for the eyelid movements and the movements of the eyeball, which leads to, when it affects these extraocular muscles, it can lead to ptosis, drooping of the eyelids, and diplopia, double vision, when it affects the muscles of the eyeball. So in severe cases, Myasthenia gravis can lead to myasthenic crisis, which means when it affects the muscles of the respiratory system, it can lead to difficulty in breathing also. It is called as myasthenic crisis, and it generally affects women in their 20s and 30s, young women, and older men of 60s and 70s. And the current treatments include acetylcholinesterase inhibitors like neostigmine and pyridostigmine. What they do is they increase the acetylcholine concentration around neuromuscular junction, leading to better muscle contraction, muscle movements. And immunosuppressive drugs, they reduce the production of antibodies against acetylcholine. And surgical treatment includes surgical removal of thymus. Actually, thymus, what it does is it produces T helper cells. T helper cells activate B cells, and B cells, they produce auto antibodies against acetylcholine. So surgical removal of thymus somehow is considered as a treatment option for myasthenia gravis.